300 disabled residents living in accommodation provided by the Disability Services Commission will be relocated to non-government accommodation over the course of 2 years. This move comes after the Barnett Government made the decision to cut back this government accommodation by 60%.
I am foreshadowing that there will be a voluntary redundancy program. It won't be massive numbers, but it will allow people the option of leaving the public service, and we need to trim the numbers.
The decision to move these services has been met with enthusiasm by non-for-profit organisations such as Rocky Bay. Michael Tate, CEO of Rocky Bay, joins me today to discuss his opinions on this decision.
Effectively, it does give people choice. It does allow for services to be provided by the not-for-profits, and we're providing the majority of services now, so it's just an extension of that. State governments generally are getting ready to outsource services to the not-for-profit sector, and certainly our state government has been suggesting that's the avenue they wanted to head down for some time, and we applaud that in the sector. We believe we have the skills, we believe we have the purpose, the missions, if you will, to provide good services to people with disability, so why wouldn't that just extend to a different range of clients that are already getting services in the government space.
While the not-for-profit organisations welcome this decision, the community and public sector unions say that this is a short-sighted plan and shows the Barnett Government clearly defaulting on its social responsibilities.
The Barnett Government's on a drive to effectively privatise or contract out work that used to be done by public servants to not-for-profit organisations. They're very clear that part of the reason they're doing this is to shed the idea of this being a government responsibility, these services, and also to drive down wages and conditions.
How can it be that we have a Premier who's going to make people redundant when we already know that we are short child protection workers? We already know we are short planners in our planning department. We already know that across a whole range of sectors in the public service, we are short people. How can it be the Premier is going to cut services when we have 1,500 people a week moving to this state?
Look, there's no need to do a cut and burn exercise of the public service. We've already seen a reduction of over 6,000 jobs in the public service in the last 2 years. Another 1,000 is just going to make things so much worse.
Currently, people with disabilities who need round-the-clock care are able to choose either a public provider or a non-government provider, and that choice is very important for people. This decision means a lot of that choice will be lost, and for people in care, when we see the 300 residential places transferred to non-government, for those people there's many who have been in long-term care, and where they live is like living in a family environment, and they're at risk of losing that. On staff, it means that people will need to find an alternate job. Many of our members are concerned about going to the non-government or private sector because what they see there is high turnover in staffing arrangements. The training is of lesser qualification, and also the pay and conditions can be inferior.
Because typically in the not-for-profit sector, workers get paid about 30% less. So, West Australians have got to really ask themselves, do we really think that child protection officers, disability service workers and many more deserve to be paid 30% less than what they are? Is that how we want to value those people and those clients?
Yeah, we're seeing unskilled and untrained labour coming into the department who are limited in what they can and cannot do in order to give our individuals the care and attention that they deserve and need.
Yet again, an example of the Barnett Government stepping away from its social responsibilities. I think again it's placing the emphasis out onto the people to do it yourself in effect, and to not provide an option to use a government-run service.
And we're talking about a very vulnerable set of clients here, potentially vulnerable. We're talking about both families being disrupted as well as the clients. And so we need to make sure, and I understand that this is a 18-month, 2-year transition on this initial grouping, and I champion that it would be allowing time to make sure it's done appropriately. Certainly those that I've spoken to in the sector, that would be the key, to make sure that any transition is done smoothly, that the vulnerabilities and the sensitivities that need to surround any transition are taken into account. What we exist for at the end of the day as a not-for-profit, our mission is to make sure that people are supported with disabilities. So we're not going to rush into this. We're going to be very conscious in making sure that that is paramount in the whole process.
The decision comes as a preparation for joining the National Disability Insurance Scheme next year. This is Jacinta Dickens reporting for Undercurrent.